Well, I think what Senator McCain's health care plan does is it leaves it up to the individuals. It doesn't forbid employers from continuing to supply health care as a benefit, but it recognizes the fact that employers are going to continue to be challenged more each year in global competition, where their competition doesn't have the embedded cost of health care. That employees really aren't rewarded in a group plan for healthy decisions that they make. And if we really want to spur the continuation of healthy decisions, exercise, weight loss, disease management for the American people, then they have to be the financial beneficiaries of their decisions. That's impossible to recognize in group plans. So I see the future as a mix of employer-based, a mix of individuals, a mix of government plans. And I think that that's truly competition, where each facet gets to see how the other one reacts. And over time, I believe that the individual market will in fact be the preferred choice of not just individuals under 65, but potentially individuals over 65. I believe that there is in the future marketplace the need for some national products that would conform to a fairly strict guideline. But I think that it requires some type of national competition to make sure that the products that are available in all 50 states meet the threshold of competition that we think consumers deserve. Part D, certainly when we instituted it, had a national component to do that. Nobody has complained or objected to the success of Part D, which has seen reductions in price of premiums and reductions in price of drugs. Well, I think that Congress has the right to make sure that we have as many different configurations in the marketplace. That's tough to do, and to respect the ability of state insurance commissioners that like to control the products that are sold. As long as they meet a fiscal fiduciary threshold, I believe that we have a responsibility to drive the innovation in products. And I think that it's only reasonable to believe in an age where we can buy something online that we shouldn't exclude from that some national insurance products that would be designed for health coverage. Well, I think the likelihood is that will be determined in the November 4th elections. We've never seen a divergence of directions like we've seen in this election cycle. Clearly, if one side wins, one can expect the federal government to take over more of the responsibility of health care, to actually place government in between a patient and their doctor. I'm not sure that's what a majority of Americans want. I think they want a private sector that works for them as individuals, them as employers, one that provides the ability for patients and their doctors to determine what the treatment is, one that creates incentives for individuals to make healthy choices, to do disease management, to lose weight, to stop smoking, to do the things that are important for us to free up enough money in the U.S. system to take care of the people that genetically are going to be susceptible to disease. We've got to do all that and still continue to have the right incentives for innovation and breakthroughs. The American healthcare system is the best in the world, but in very short order, it could become the biggest disaster in the world. And I think we've got to make sure that we're vigilant at making sure that we protect the quality, the efficiencies, and the care that's delivered in the U.S. system.